Thank
So
you.
this topic is digital and digital transformation. So I mean it's so vast. It's such a vast topic, especially in the context of health and wellness. It has so many applications, so many use cases that we could spend the entire day talking of digital transformation in this space. But I, for one, who has been focused on social impact using medtech, I would actually root for the rural Bharat. What? So there are two parts to this country, very, very distinct parts to this country. There is India and there is Bharat. So I would I see a lot of young people here. I see a lot of experienced people here. I would like to start by asking a few questions. Which is, do we know how many villages we have in this country? We are a vast country. How many villages do we have? Can someone please tell me? Anybody would want to take a guess? Yes, of course, definitely it runs in like. So, it's 6 lakh villages. 6 lakh. And how many, what's our population that stays there, that stays in the villages? Yes, you're right. 60 to 70%. About 90 crore people stay there. So ironically, all the advancements in medicine that we talk about, all the advancements in this space that we talk about, they impact hardly 50 crores out of the 140 crore that we are. 90 crores are the have-nots, I would say, as far as this is concerned. They might have food, they might have home, they might have land, etc. But they really have-nots as far as medical and healthcare facilities are concerned. I am based in Thane. Thane is a large district. It's just outside Mumbai. But just go out of Thane. Just go beyond Bhiwandi. And you will see that your mobile network, of course, now there is a lot of improvement, but the healthcare facilities just simply drop. So 90 crore people in this country do not have access to any diagnostic facilities. So will you believe that when treatment happens there, treatment happens blind? So doctors, when they're treating, they do not have the benefit of diagnostic tests to be able to do that. So I would like to ask you a question, Souvik. Considering you are an AI professional, considering that I already spoke about the inequity between rural and urban Bharat or rural and urban India, how do you see us leapfrogging? It is very clear that there is a lot of inequity. There is a lack of facilities in the rural India. How do you see AI as an AI professional? How do you see AI helping us leapfrog?
So firstly, thank you for inviting me here. It's a privilege to be here. And Sandeep, it's an interesting question. You have spoken of AI a lot. So I would like to just hit a bit to give a small background around AI. So as you all must have heard, all the leading professionals from Google, or Meta, Tesla, talking about AI. So AI right now is being thought of as something which is probably as profound as electricity or fire, which are kind of considered the basic earth elements. That's where AI is trying to enter. As Mr. Sundar Pichai and lots of other people, again, all the leading global business executives on this planet have looked upon AI as. So, when it comes to AI, the way I see, with our company Manastik and in general, is that we shouldn't be looking into AI as something which is trying to replace, because if we are trying to do that, I believe we are trying to solve not a wrong problem, but we are trying to kind of hit some bullets in the dark, because there are multiple challenges when we try to do something to look into AI as something which can do everything on its own. But my perception around AI is, it should be looked around something that can be used as an assistive tool to whatever exists in the current ecosystem. Then the real benefit of AI, starts coming into picture. And coming to the question of, the point of leapfrogging AI, what I believe, is that AI, AI firstly has transformed, it's not just AI, but in general, health tech. I think all the I think all the medtech ecosystems in this, in this hall would agree that there is an added interest in terms of how and why health tech is getting a lot of interest from all the stakeholders, investors, doctors, entrepreneurs, anyone who is trying to venture into something out of his own. So usually in the last last half decade or so, it's mostly people are trying something, not mostly, a lot of people are trying majorly into medtech and to do make a difference because there is a need, there's no doubt about it. Now when it comes to AI, the most important thing is, as I mentioned, it's important for us to see it as an assistive tech. And how, as Sandeep spoke very beautifully about the percentage of people in rural areas, and most of those cases, what I know from a neurology perspective is that there is no proper neuro care and there is no proper neuro rehabilitation. There aren't proper neuro rehabilitation professionals as well in the rural areas. So they are usually saturated in the urban areas. So what I have seen from my journey, is the fact that remote and remote, so teleconsultation platforms and a remote care is already the the need of the hour. I think it's already being solved through technology. And apart from that, AI can also play a very big role in helping the whole ecosystem by and large. So for example, so I'll again head back to what AI is and what AI does on a very fundamental level. So we humans are extremely good at thinking, but but computer is extremely good at the computational power. So when we kind of put it together, when we try to think of a system, when we put it together, what we get is the AI. So by and large, so what happens is when we try to, for example, AI can discover multiple patterns around what is needed where, which is very hard to decipher with our, with our brains, or which even with aggregated and collective human efforts. Then, when it comes to, so as Ms. Varsha said previously, around accreditation, it's extremely important that, AI systems, that whatever, we use and whatever we develop as well, both ways, all the stakeholders, we voluntarily opt for it, and we, to ensure that we are certified, we're accredited. So we have been talking about, around, let's say there's a healthcare app or a healthcare product. It needs to be clinically validated, be it physical or digital. Now, how about creating AI systems which will need their own accreditation, their own, their own certification? So I believe, so these are some of the standards which are necessary, and through the help of these, I believe, it can create big impact in terms of how the whole ecosystem will come into picture. So, and the most important thing is, as soon as we say AI, there is the automatic technology which comes into picture. So when we say that AI is being used here, or is being used there, or might be used, whatever, so we say that technology might already have taken some place, or it might be in place in that existing ecosystem. So on that front, I believe it can play a very big role around, how it can create an impact, and also it can, of course, act as a constant companion. That's around the technology in general. So Sandeep, I would like to, ask you around how can digital care impact the rural Bharat, and help on the affordability front?
Let me paint a picture of what the near future holds good for us. I see there are leading doctors here, clinicians. I see Apollo people here. So the future is that presently today, that a villager, when he develops a problem, he goes to his local doctor, or he heads to a sub-center where there is a Ayush doctor there. Sub-center is the last mile of our healthcare system in this country. So we all know that there are primary health centers, but under every primary health center, there are about 6 or 7 sub-centers. And this government is now looking at upgrading them to health and wellness centers. So we will have, say, in another few years from now, about 250,000 health and wellness centers. Those for 6 lakh villages, I think decent, 1:2 or 1:2.25 kind of a ratio. So this villager walks into this place and using AI, a symptom checker actually decides as to what he should get himself tested for. Okay, so he goes and states his symptoms. There is a health worker there. AI tells him that these are the various tests that you could get yourself tested for. There is the Internet of Medical Things. So there are devices which are there in these health and wellness centers. He gets himself tested. After his test results are out, the system again says as to which doctor in Apollo hospital in say Mumbai or wherever a large Apollo hospital is, which hospital should he get connected to which specialty should he get connected to. So this patient is then connected to that doctor. Because there are electronic health records that are created, so there is interoperability. The government has brought about systems called Aabha. Aabha is a system that where we are talking of a universal number for everyone, just like we have Aadhaar. So because there is Aabha, the doctor at the other end will have the test results of that villager and be able to prescribe. Now that prescription will be available at the local health and wellness center, from where it will be fulfilled and the medication provided to him. Can you imagine this scenario? Even in the urban space, this kind of a scenario would be phenomenal. But that is the possibility of digital and possibility of AI. So all the intelligence that all the doctors have in their head regarding, what to do when there are some symptoms, etc., all of that has already been crystallized into databases which are available, which are called symptom checker databases. This is the future that I foresee happening. This means that that villager does not have to travel a long distance. He doesn't have to travel 50 kilometers. He doesn't have to lose wages. He doesn't have to go to, say, imagine today a villager in Chandrapur. Chandrapur is a suburb of Nagpur. If he goes to Nagpur to get himself treated for something serious, he has to also look at where will he stay, what will happen to him. Those are things that are totally eliminated. Those are costs that are totally eliminated. So we are talking of access. We are talking of the cost coming down and very high level of access being available to the best of healthcare. That is the possibility that we have with the AI. Now this is the positive picture that I painted. I would like to ask my friend who's an expert in AI as to what are the challenges that we foresee going forward. While this is all good, interoperability, connectivity, Internet of Medical Things, AI, etc. What are the challenges that we foresee?
Yeah. Thank you, Sandeep. So, that's a very interesting and important question, because we have all spoken about AI a lot. So starting with, with respect to AI, the first challenge that usually highlight is around privacy and security. So let's talk about a bit in detail around it. So when it comes to AI, we with our own app Manastik, and in general, when I've been in this health tech ecosystem for around half a decade or so right now. So most of the doctors, clinicians, and other healthcare professionals, they keep asking me, you tell me you have a beautiful app, you have a good product, that's all good, but how will you ensure that my patient data is 100% safe? That's the very important question. They tell me you use AI, you use blockchain, you build your own technology, all good, but all we want is privacy and security. Thappa, hona hi chahiye. How will we ensure? Which is an extremely important, valid question from their side. So around that front, so given that fact that ours is a mobile application and we have a cloud-based infrastructure, so obviously AWS and other GCP and other those cloud partners, they are taking care of it, and there are certain privacy norms as well which we are adhering to. But apart from that, the important point which over here is we need to ensure is all the data in healthcare ecosystem should be encrypted and confidential at all times. It should not be, not to me as well, not to anyone, only to the person to which the data belongs, is what we say. So privacy and security is an important thing. Nextly, when it comes to data, then bias. In AI, usually AI systems, no matter how good they are, they're usually biased. So we can't do anything about it. There's general perception. There will always be a bias. So you all must have been reading, the DeepSeek versus the ChatGPT, the discussions going on publicly and in the internet, which you ask questions about this and that, you get answer. You ask questions about something else, you don't get an answer. So AI will always have always have a bias. So it's going to be a challenge for sure. Then then coming back to the certifications and norms, as I mentioned, so healthcare systems need to be certified, clinically validated, accredited. But at the same time, we need AI models as well, AI systems, AI infrastructures, which should have their own standard, which should have their own regulatory standard. It's not just across India but globally, which I believe the efforts are being made, but we need to have those in place as well, so that any AI system can also get a green check, because that right now is not being done, which I see in the Indian ecosystem, which I believe should be happening in the upcoming years. Then then along with it, the other challenges are so India is a diverse country, so naturally one challenge in which even if we have the AI models in place, we need to have those in rural Indian languages for them to reach out to the masses. As I think we already had a discussion that almost three-fourths, or rather 2/3 of India lives in rural areas. So on that front, it is it's kind of extremely important for us to know. It's paramount for us to know that whatever we develop has to happen in local Indian languages for us to actually do it on the ground, instead of just in the urban areas where anyways technology has been deployed today, as of today. Then apart from that, there are multiple other challenges, with AI. So as I think this gets discussed in multiple AI conferences, that as soon, whenever we use AI, the cost increases. So again, there's a challenge of affordability. As soon as affordability comes in India, deploying any solution which is costly becomes a bit hard. It becomes a bit hard, to be honest, because when the cost goes up, the number of users paying sometimes go down. So then there are other multiple challenges, along with AI, which we have faced, is correct and accurate data. So without data, honestly, there is no AI. I mean, we can always think of data profiling and multiple other aspects around, or thinking of doing something to just get started, which we had also done when there was no data. But without data, it's very hard to build an AI model. It's not possible at all, is what I can say. Then along with it, then some of the other challenges range from the fact that the AI models, right, they need to be, for example, even deploying previously in the last decade also, deploying an AI solution and the logistics around it was a bit hard. But now with the global, improvement, rather progress of technology, that is not hard anymore. So I won't say that's not a challenge per se. I won't say that the challenge has completely kind of been erased. It's still there, but it has been mitigated to a good extent, I believe. And along with it, so also the way I usually look at it is, AI challenges in AI, to not kind of look at it from a generic perspective. The way usually I think of it is, let's say we consider a domain, be it in terms of let's say telemedicine, or let's say some other, hardware product that we have. So how are we going to deploy the app or that particular product? That is how I usually think of, what are the challenges going to be, because the challenges in AI, they are extremely use case and test case specific, is what I can say confidently sitting here. So I believe these are some of the important challenges. But again, as I mentioned, if there's an app to be deployed or any solution to be developed, then we can deep dive into some of the deeper and exact challenges that we might come across with AI.
So as we spoke of the challenges, I would like to actually do a small exercise and do a bit of crystal gazing as to what the future holds good with digital. So would someone like to, gaze into the future, or share a wish list as to what if this were to happen? Would anybody like to say, what if my life could be impacted in this manner? And I will try to, give my views on that.
Okay.
about accreditations and validity and certification. There's so much of going on that side, and we are simply depending on AI on some data, right? So what is the authenticity of the AI results, and who is accrediting it? Or is there any standardization for AI, for the data which is being given for
So
the
you-
AI to give results?
So you wish that there could be some standardization because it's
Yeah.
like a black box today.
Exactly.
It
Yes.
seems so potent, but at the same time, no one really knows what it holds.
We really don't know what we are sitting on
So
exactly.
the beauty with most AI models is that they train themselves, so it gets better with time. It gets absolutely much better with time. So that brings me to a use case which, ma'am, you would like to say something?
I want to ask a question.
Sure.
I am Dr. Mandakini Meg, and I was holding the post of Deputy Director of Health Services for a long time. Actually, I am seeing this from the perspective of a government employee
Yes.
or a government doctor.
Sure.
Because private is all right,
Yeah.
but sub-centers where we worked,
Yes.
primary health centers we worked,
Yes.
World Bank, that MHSDP project had come in my time. That time is strengthening of the rural hospital.
Sure.
So, lot of work is being done by a poor medical officer who is 24 hours there.
Yes.
So, I can see how the AI and digital health will change the quality of life of that particular doctor who is serving alone in that
Absolutely.
center. And how the patients will directly be benefited. That is my actually dream to see that they should be empowered. They should be having this, and indirectly government will have better outcome of the patients. That is what is.
So were you here when I painted the picture of how a villager's
No.
healthcare journey
I
would
just
be?
came.
I will explain to you one-on-one. But I attempted to do that.
Yeah.
I think you were not there at that time.
That's okay.
But one of the areas that I would like to touch upon very briefly is precision medicine. So I foresee that AI will help us with precision medicine or with personalized medication. As these systems like ABHA, etc., as all of them become stronger in this country, unfortunately, as of now, it's voluntary. And there are also some incentives being given. But as ABHA, etc., takes root, or we have interoperability of health records, there is a lot of data which AI can then use to actually even predict my health 5 years down the line, 10 years down the line. What are the issues that I could face? Even those are things that are possible. So this is a vast possibility, and this, in my opinion, would help us leapfrog, because today we have scarcity of resources, healthcare resources. It will really help us leapfrog. We would really be leveraging digital to actually leapfrog into a much better. Someone told me, I was telling someone that the US has much better healthcare systems than us. So someone corrected me in a forum itself, and they said, no, US in a 1 square kilometer radius would have more McDonald's than a primary health center. So this is a universal issue that we have as far as primary health is concerned, and digital and AI could actually help us leapfrog. Would like to say?
Yeah, I think you've covered the points pretty well. And, as you said, so even with our app and in general, so personalized healthcare, I think is going to play a very big role, in the ecosystem today, because what we need is not something, which is generic, but which is highly tailored and catered towards that particular type and stage of that particular, user. And secondly, predictive analytics is going to, as you mentioned, is going to be extremely important. So for example, a very simple example. So when I drive down to Mumbai from Pune, and when I sleep a little less, my mind is a bit different. So if this thing can be understood by AI, but if this thing can be understood by AI over a period of several months, they'll be able to even understand how my behavior might change, which might be a reason of something, might not be reason of something as well. But these are some of the interesting things that AI can obviously come up with, and definitely leapfrog today.
Thank you for being patient.
Yeah, thank you for listening, Russ.